Hi, Dr. Dave Webster again, and this is part of my video blog series on the travesty of PET in Ontario. And this is a particularly important video. I'm going to call this patient Carol, but she's representative of what happens to patients in Ontario on a daily basis. And her life did become a living hell, and 100% because of her physicians were forced to follow Cancer Care Ontario's so-called standards of care or practice of medicine. This is Carol's PET scan. I'm not going to go to it in detail, but these little black spots down here, I'll show you in some pictures later. That's actually cancer. But what you will see, and the unfortunate thing here, is that this PET scan was only allowed after Carol had undergone a mutilating radical radiation therapy to her pelvis. What Carol's experience, I think, will make clear to you is why PET-CT has been the world standard of imaging management of cancer, but other diseases, dementia and so on, for more than 20 years. It will also make clear the basis of the unprecedented accusations in the history of public medicine in Canada of the Ontario government performing unethical, bordering on immoral experiments on patients, and that it is an agenda-driven assault on Ontario's patients in a misguided and failed effort to, you got it, about money, reduce healthcare spending costs, and Carol will suffer the consequences. It also translates directly to the fact that Ontario physicians are forced to practice medicine which would be incompetent or considered worse in medicine, for example, in Quebec or elsewhere, and what happens to Carol is, as I said, happening to patients on a daily basis in Ontario. It will, I believe, demonstrate in spades the kind of cold-hearted and callousness of the Ontario government politicians and the medical experts who were told many years ago by the government to discredit, delay, and block PET because of cost concerns, and in fact no one on the planet has done a better job. But why can I make that radical statement? Well, this is Professor Rodney Hicks. He's a recognized world expert on PET from Australia, and he said to me in 2016, David, Ontario has the most egregious and politically motivated agenda against PET, and of course read our patients, in the world. Now, as you watch this video, I want you to keep in mind, this is the patient ombudsman, so-called watchdog. This is Christine Elliott. She is a previous Conservative MPP, and she ran unsuccessfully for the leadership of that party, and she was married to Jim Flaherty, to just give you an idea who this woman was, to jog your memory. But the point is, her mandate as the patient ombudsman is laid out in a 2010 act called, quotes, Excellent Care for All Act. Now, Miss Elliott will be made aware of every aspect and issue related to what will happen to Carol. Now, I also want you to keep in mind as you watch this video that because of my efforts to prevent what you're about to see happen to Carol, I have been threatened by the Ontario government, Cancer Care Ontario, and the College of Physicians and Surgeons of Ontario. If I continue to speak to physicians or patients or give them information and facts about how the liberal medical experts have assessed and blocked PET-CT in Ontario, I will lose my hospital privileges and possibly my license to practice medicine in Ontario. So, a most tragic case to begin with. Carol, she's been a nurse. She retires to find out, with all the plans she has, of course, as we all would, she's got cervical cancer. So because she lives in Ontario, she can only be staged by a CT, and she also has an MR. Now, if you go to Quebec, or for that matter, Chile, physicians there would know that Carol really needed a PET-CT scan to best stage her cancer to give her the appropriate treatment plan. So I happen to be asked by the patient's oncologist to be a management about, a consultant, as it were, about imaging management of her case. So what I do is I apply to something called PET Access, which is a Cancer Care Ontario committee, because I believe, and the literature certainly would support, that Carol needed a PET-CT scan before any therapy was planned, but this is denied. So she has her CT and MR, and they identify the cancer, and looking at the rest of the body, they thought maybe there's a little enlarged lymph node on the left side. It could be cancer. I'm not sure. It just says, makes clear this is not definitive. And in fact, you will see from my other videos, as I think I've already pointed out, it is incapable of determining whether this node had cancer or was a previous enlarged node from, say, an infection in her pelvis. It's impossible. Anyways, she also has a consultation with a McMaster. Remember, McMaster is heavily involved here, a McMaster-based surgeon who tells Carol, good news, there's a good chance of a cure here if you undergo radical radiation therapy to your pelvis, followed by surgery. Now, Carol knows exactly what that'll entail because she was a nurse. However, because of the chance of cure, obviously Carol takes that advice, and that her CT and MR are used to plan the radiation therapy. Now, this is the kind of thing that the room that Carol would have been into. This is a machine that shoots radiation through Carol. It's called an IMRT radiation therapy machine. I'll have a video maybe on the technical aspects some other time, but you have to remember Carol's in this room by herself, lying under this table as this monster machine shoots radiation through her, lethal to the cancer, ideally, and she undergoes more than 20 radical radiation therapy. And as expected, she begins to suffer from the complications which occur to passing radiation through the body. The radiation has to pass through normal tissue to get a dose to the cancer cells. So this is the kind of radiation damage that she would have had. This is not obviously pictures of Carol's colon, but this is what a normal colon and the rectal area would look like. This is the kind of damage that Carol underwent, and you can imagine for yourself what Carol experienced having this kind of damage to her bowel. Plus, of course, the bladder's in the pelvis too, isn't it? And this is the kind of radiation cystitis that she underwent or had suffered from as well, but was willing to put up with it, of course, because there was a chance of a cure. Now, again, her PET-CT drives home the point, remember we only got that after the therapy, it drives home the point of why PET-CT is the world standard and has been so in some cases for 20 years. It demonstrates that even if it had been possible to cure Carol's cancer, the left pelvic node on the PET-CT in fact showed definitively that it did actually have cancer, but because the CT wasn't definitive in the radiation planning, the cancer is undertreated. It does not get a lethal dose. So what you can see here is this little enlarged lymph node. Again, the CT just says, well, it's big, no idea what it means. Now, here's her PET-CT. And you don't need to be a physician or a genius to know that there's something wrong there. This is way too much sugar in this enlarged node, and this is, in fact, cancer. But in addition, here we see a normal-sized lymph node in the right side of the pelvis. Would never be reported on the CT or MR because it's absolutely normal size. But again, look at the pad. This contains cancer as well. So she cannot have more effective radiation to now try and kill the cancer cells that are clearly present in her pelvis. So even if a cure was possible, this opportunity is lost to Carol forever. And yes, she will eventually die from her cancer, even if it had have been possible to cure her. But as I'm hinting at, that wasn't the bad news. The bad news was that the PET-CT showed that she already had stage 4 untreatable disease from day 1. She has an abnormality in her pelvis here, and lymph nodes are up in the abdomen, actually. This is a right adrenal metastasis, and she's already got spread of cancer to her lungs. So Carol's false hopes for a chance of a cure based on her CT and MR, which were compulsory in Ontario, weren't even possible from the beginning. Her radical radiation mutilating therapy to her pelvis, remember you saw those pictures, was contraindicated and never should have taken place. Was Carol assaulted both physically and ultimately emotionally? You decide. Now, what she has to deal with now is she's going from a possible cure to terminal cancer. So actually that was, I think, in, March or April when we did the scan. She died, unfortunately, in October, and she spent the last 3 months in the hospital, ended up in a hospice, and she was in constant pain, and she had swelling in her legs and all sorts of residual complications from that radiation damage to her pelvis. We looked at some of these things. This happens to be the kind of leg swelling that Carol had to put up with in her final days of life on this planet. Now, her physicians were forced to do this to Carol, based entirely on Cancer Care Ontario's so-called standards of care and evidence-based medicine. Now, but what about, Miss Christine Elliott, the patient ombudsman? She knows every detail of this case. For the patient ombudsman watchdog, Miss Elliott, Carol's case represents excellent care for all patients in Ontario. And remember, I've been threatened with the loss of my hospital privileges and license to practice medicine in Ontario because I tried to prevent this from happening, and am now giving you this information. So this is exactly what Wynne Hoskin's liberal so-called evidence-based, patients first healthcare really means for you on a daily basis. And this is courtesy, of course, of Cancer Care Ontario, our future health built with care, McMaster University evidence-based medicine school, and with a little help from Ontario's ombudsman/watchdog. I have a lot more to say about that, but this is Mr. Dubé, Paul Dubé, our current ombudsman. This is Ms. Barb Finley, and of course the Ms. Christine Elliott, patient, ombudsman, watchdog extraordinaire, and this is excellent care for all. So in my next video blog, this is Dr. Margaret Chan. She was the Director General of the World Health Organization from 2006 to 2017. So I'm going to tell you what Dr. Chan had to say about my advocacy efforts in Ontario to try to prevent this from happening. So again, I hope you'll watch my videos, subscribe, support this, and do whatever you can to finally demand that this issue becomes an election issue so that we can finally have our patients move into the actual current era of medicine on the planet. Thanks.